Good morning, Senator Garrett. My name is David Block, and I'm a constituent of yours in Greensboro, North Carolina. I come to you today to talk about the nursing workforce shortage. Now, currently, there's no legislation in North Carolina or many other states to help this problem, and that's why I come to you today. So, why do we need more nurses? The quick answer is the demand is increasing faster than the supply. Enrollment at nursing schools has increased by 5%, but this falls way short of the projected 7% that will be needed by the year of 2029. So each year there'll be 175,000 nurses that are needed that we won't have. By 2030, this will amount to close to 500,000 nurses that we need nationally. And the South will be one of the areas that gets hit the worst. So North Carolina will rank second as on the highest rank of shortage of nurses. So why is the nursing shortage a major issue? It directly impacts the quality of life of nurses as well as the quality of care and access to care, which is a social determinant of health for patients. The nursing shortage creates a great overwhelming burden of stress for nurses. This stress pushes nurses away from the bedside. It forces them to get out of the profession. And it also, due to the pandemic, has created a bigger problem when it comes to this. Studies have shown that if you take one nurse and you give them one extra patient and increase their risk of mortality of their patients by 7%, which is a big deal. So what are the defining factors? The major issues have been that there's been a demographic shift in the population. There's a lack of nursing educators, and as well as a high amount of nurses that are retiring. Older nurses are retiring quicker, also due to the pandemic, but this problem just continues to get worse. So lack of nurses and educators each year turns away 50,000 quality applicants for nursing schools. And at nursing schools, enrollment falls way short of what is needed to produce advanced practice nurses that can facilitate and help out with doctors. There has been a shift of demographics to a population being much older, which creates a bigger burden and calls for more nurses to help out with that. So what have other states and organizations done to combat this problem? Well, the University of Wisconsin provided $3 million for fellowships and loan forgiveness for nursing educators. The University of Minnesota provided $5 million to build clinical sites, compensate new educators, and to help to work for interprofessional engagement. Johnson & Johnson started an initiative in 2002 to market nursing careers. They use commercials, video recordings, handouts, and the North Carolina Nurses Association has provided recommendations to increase market-based compensations to expand nursing faculty. So what is the solution to all this? Well, first of all, the main factor is that we have to expand the nursing educator population. In 2021, on your website, you mentioned that one of your biggest goals is to expand Medicaid coverage, which is absolutely wonderful. It will improve access to care for parts of the population that need it the most, and it's a major social determinant. This, however, needs to go a step further. We need to provide more nurses through providing grants and money to help expand the nursing faculty so that we can train more nurses. That way we can provide the support to improve the access to care and provide the support that Medicaid coverage needs. this is the most effective way to expand the population of nurses. I'm proposing to you to help out with this mission by helping to put forth legislation that will provide money and solutions to combat this problem. Thank you for your time, and this is the reference that I've used in my presentation. Thank you very much.